Now, Wion correspondent Lucy Taylor is joining us live from Moscow for more on this. Good evening to you, Lucy. Thanks for being with us. Russia has now reported more than 10,000 coronavirus cases for the fourth consecutive day. Why this sudden drastic spike in cases?
Yes, it shows that the cases are continuing to rise. On Sunday, that was a record, more than 10,000 daily cases. But every day since then, the same thing. It's very worrying for people here in Russia. There are some who say it suggests that Russia isn't in control of that outbreak, perhaps that the outbreak is spreading beyond Moscow into areas where it's harder to control, where there are less resources and where the health system isn't as established. The Russian government, though, says that it's because it's doing such widespread testing, it's catching cases that perhaps other countries wouldn't catch under their testing systems. So asymptomatic cases, for example, people who aren't showing symptoms yet. But yeah, very worrying still, because the rise in infections isn't slowing at all. The only glimmer of hope, as you mentioned, the low number of deaths relative to the high number of confirmed cases. If those figures are accurate, that does put it among the most controlled in terms of the death toll in the world.
Now, the lockdown is set to end on the 11th of this month. Have you got any update on whether this date will be extended again?
Well, we're waiting to hear from the President, Vladimir Putin. He's due to speak around now to a meeting of his officials to discuss the plans for that moving forward. Last week, he asked them to draw up recommendations as to how lockdown could be eased. The current lockdown ends on May the 12th, but it doesn't seem likely that Russia will just come out of lockdown entirely because of the number of cases continuing to rise. It's very difficult to see before Russia approaches that peak, before the peak in cases is seen, that any easing of lockdown could take place. But we're waiting to hear that at the moment. Certainly the economy is a major consideration for the president and for his officials, because it is having a big hit on the economy, having everybody in at least partial lockdown across the country. Vladimir Putin has also left it to his regional governors to decide exactly what happens region by region, because, of course, this is an absolutely huge country geographically, and the virus is taking a different form and at a different stage of the outbreak across the country. So he's left the intimate decisions to his regional governors. Here in Moscow, where, as you said, about half of the infections have been found, there is a fairly strict lockdown. People are allowed out to go to essential work, they're allowed out to seek medical help, and they're allowed out on foot around their area to go to the nearest shop or to go to the nearest pharmacy. But apart from that, if you want to travel anywhere, you need a digital pass on your phone to show to police if you're stopped. So a fairly strict lockdown. Difficult to see then why these cases are continuing to rise. But as I say, it's difficult to see any easing of the lockdown really until those cases start to slow.
Right, and Lucy, earlier you touched on healthcare. Now, ventilators. There seems to be a large number of ventilators. It's about 27 ventilators per 100,000 people. This is even more than the US, but we're hearing reports that they are apparently broken or of substandard quality.
Yes, going into this, Russia was very proud of its number of ventilators, as you say, fairly high compared to other countries around the world. There have been reports, though, over the last few weeks that many of those are old, are in some cases broken. There have been doctors trying to raise the alert that perhaps the equipment in their particular hospital isn't up to scratch, and the authorities, of course, have tried to deal with that as they can. There have also been concerns about personal protective equipment, as in other parts of the world. Doctors raising the alarm that they don't have enough. President Vladimir Putin in April said that it's true there wasn't enough personal protective equipment for the whole country, for all doctors, but that the country is ramping up production and imports to try to get there. And he said that in general the healthcare system does have what it needs to cope with the outbreak. As I say, some concerns in regional hospitals that they might not be as well equipped as those in Moscow. But he says for now the country is coping, and as long as people help the country by sticking to that lockdown, then he says the country will be able to cope.
Lucy, thank you very much for that report. That's Wion's correspondent Lucy Taylor bringing us the latest on COVID-19 from Moscow.